they have shared in common between all of the early childhood care facilities. And very often these are small businesses paying individually for these services, but if they were to operate as a co-op and were to share services like accounting services, payroll services, HR services, health insurance services, that would reduce the costs to financials to early childhood care facilities across Northwest Arkansas, and they would be able to devote more of their financial resources towards providing better pay for their employees and providing better training for their employees. So that is one aspect, one opportunity that we have here in Northwest Arkansas, is to provide a shared pool of services, especially across accounting and HR functions to these early childhood care facilities. The other thing that we could do to improve their viability, obviously, is that there are some childhood care facilities that have sort of a very long waiting list, and there are other childhood care facilities with the same quality ratings that don't have, are not full and could very much use 2, 3, 4, 5 more families. And so it's important to provide a matching service within Northwest Arkansas that shows parents where there are availabilities and allows those early childhood care facilities to find better matches than they are currently finding in the marketplace.
I feel as a parent, whenever you decide that you need to enroll your child into daycare, is going to be letting go of control. So it's easy whenever you have that child at home, setting your own schedule, but really as a parent you have to adapt to the school schedule and whatever they go with. That's what I told my child care workers, is that you guys set the schedule and I will follow it at home, because my kid is with them Monday through Friday. And it's tough to let go of that control, but once you do, home life is a lot easier.
So there's several challenges that come with working families and trying to find quality early childhood education. And some of the ones that my family have faced is always obviously cost and the price of education. And that is something that initially, early on, was a major contributing factor. But the more that we were educated in the quality, then obviously you don't want to skimp on your greatest asset. And so the cost is one thing, but also, again, you're looking at the quality of the personnel. So staffing and their qualifications is something both that's important to me as a parent, but also these the centers, the directors, and the owners of these facilities constantly struggle with having to meet either the state's requirements or their personal goals for what their staff is, what their baseline standard for qualifications are. And in an industry that if you have much more than that, then you can get into the public school system as a teacher or substitute. And so that has a high turnover rate. And so that's a struggle as well. So finding that perfect balance of staff that are qualified, trained, experienced in that field, and who won't jump to that next level.
We would like to thank all of those who participated in our endeavor to show the impact of quality care in our community. Get involved, contact our office with the information shown below.